about that. Well, welcome to the world of wisdom, beauty, health, and fitness ministry. My name is Dr. Malika Hendry, and I am so glad you are joining us today. I have Wendell here, and I have Jennifer here, and we're all going to talk about this. The topic is a new hip and a new walk. A new hip and a new walk. So many people out there, including myself, have had or will go for or have a problem with the hip or the knee. Today we're going to talk about the hip because that's what I have went through. What do you want to say about? Okay, Wendell, tell us a bit about you first of all before we start. What? Go ahead.
Before I say anything about me,
Okay, all right.
I'm just so happy because I seen you before your hip surgery.
Yeah. Okay.
And I have the blessing of seeing you right now. You're so much more energy, so vibrant, painless. Right, you were going through so much pain, and I just wanted to say that about you. It's just you're like a new person.
I
and I
thank
really
you.
wanted to make that comment, that observation.
I thank you. And what do you have anything to add to that?
most
My friend,
certainly
I've been knowing him for a couple of years, and I've
Yes.
known her for like 20 years. What do you want to add to that,
I
Jennifer?
most certainly do. I want to say that it's amazing, absolutely amazing. I did get the opportunity to see you before your surgery and spend a little time with you before your surgery. And what a remarkable difference. And I was also amazed at how quickly you
My
came
God,
around.
You came around so quickly.
So
yeah.
it was, I always thought that hip surgery is something that would keep you down for months.
Yeah,
But I guess with the new technology, my
Modern
goodness.
medicine, yeah.
Yeah, and look at.
Well, this is like a testimony. I have to. This is a testimony of what I went through. Like Alicia Keys says,
Oh.
this girl is on fire, and I am here to tell. I mean it. I'm on fire. I'm an advocate to tell other people if they are suffering with hip problems, pain, or discomfort. See your doctor. Do what the doctor tells you to do. What happens? I would see what happened, Jennifer and Wendell. I was healthy before I went in started getting all this pain, and I said, "My God, what is this?" So about 6 years ago, honestly, about 6 years ago, I felt a little kink in my right hip, and I'm a nurse. I was working at a hospital, and then I'm what am I? A cosmetologist too, doing hair. So I said, "What is this?" And he gave me. Finally, the doctor gave me an X-ray about two years ago,
X-ray.
and an X-ray, and that's how you find out an X-ray. And he says, "Oh, your cartilage is wearing out." And I says, "Oh," and he showed me what they were gonna do. Can you show that cartilage on the bad? What it looks like when it's bad? The cartilage. Okay. And it says here, you got it right there. Let me see
Yes.
yours right quickly. It says here on the top there. Okay, here we go. I want to share that with you. Okay, here we go. The top cartilage damage right there, a damaged hip. Osteoarthritis. I'm just going to talk about that one. As time goes by, normal wear and tear can add up. Cartilage may begin to crack, which is osteoarthritis. That's what I had. As the bones rub together, oh man, they started rubbing together. They become rough and pitted. This wears down the socket. You can have inflammatory arthritis, a fracture, person fall, and necrosis. This is a bad injury or long-term of alcohol, or steroids. Can reduce blood supply to the bone. Can you imagine if you drink
Wow.
all so much alcohol and
Yes,
all of
I can
that,
imagine.
and that reduces the blood supply to the bone. And if the bone dies, necrosis, the joint will decay. Isn't that something?
It's like bone on bone,
Yes.
which is a lot of sports injuries too.
Yes,
Exactly.
absolutely,
so it's
absolutely.
unbelievable.
Now, genetically, my father, we're just talking now, my father had 2 knee replacements. So I have always been a healthy, Wendell, healthy woman, jogging, walking. I don't do a lot of jogging. Walking around the Rose Bowl, 3.5 miles for years. Going to the gym, exercising, eating right and everything. When this thing came up, I said, wait a minute, what is this? I've did everything right, God. What is this? So I kept on trying to live with this thing, and took Progesic, which is supposed to place some more cartilage back in there, and went online and bought hundreds of dollars worth of medicine and all that, pills,
Painkillers.
painkillers too.
Oh, yeah, I would
to help
imagine.
this, because
Would
I
imagine some
said
painkillers.
my doctor told me what they would. He showed me what they would put in me. I held it. I said, "Oh no, you won't." Oh no, that was about 2 years ago. No, about a year ago. I said, "I'm not going to have that put in me." Oh no. So I kept on physical therapy, acupuncture, everything that I could do. And I said, and then finally I went back to the doctor. I was using a cane in the beginning. First, I was limping a little bit, and a couple of people saw me. And then I started using the cane. And as a nurse, I do home health care. I started bringing my canes to the house when I had to
Help the patients.
help the patients. And I said, wait a minute, this is not right. And I would hide. I didn't want nobody to see me. I didn't want my
that
friends and
pride.
all. So 2 years, a lot of people hadn't seen me. This is, okay, praise the Lord. This is my first show back from I stopped doing my shows about 3 months ago. But now I am back in this, and now I am an advocate to say, go listen to your doctor. Some people do not want to go for surgery. Why? Why? Why?
Fear.
Go ahead.
Yeah,
Let's
it's
talk about
probably
it.
it would probably be fear, and the thing is, like I always say, no pain, no gain. I mean, you got to go through the pain of the surgery to gain, the relief of
to find
not having that chronic
Yes.
pain situation. And I would think if the diagnosis is a chronic diagnosis, meaning that it's not going to go away. The blood supply is probably not there. There's so much inflammation. There's rheumatoid arthritis or whatever the problem may be. It is different for different people. Sometimes it's genetic. I remember when Bo Jackson, when he was hurt on the football field,
Yes.
they said it was also a genetic thing.
Right.
And so you never know. Everybody's different. No one's the same. But if you have a chronic illness, that means you're going to live in pain for the rest of your life, which makes no sense. That's going to affect every aspect of your
absolutely
life.
no
Do you know when I was going to CVS, all of those places, and getting aleve? Everybody knows about aleve.
Oh, yeah.
Yeah.
They would run out. Do you know there's so many people out there, and they run out of aleve and Tylenol on those shelves at those places? Wow. So many people are in pain and discomfort.
That reminds me, I ended up chatting with a gentleman by the name of Charles Adams. He lives in San Diego. He also had the surgery.
Okay.
And what he was saying to me, he wrote me a little something here. He said in 2006, after having what he thought was just a little muscle pain.
2006, that's when I started. Go
That's
ahead,
when he
go ahead,
started.
Go ahead.
He said he was having a little muscle pain, a little muscle
Yes.
achiness, and it seemed to continue, and it increased and
Slowly
started
but
getting
surely.
worse
Yes.
and worse and worse. And then he decided to go to the doctor and to find out what was going on. And he said he was not prepared for what the doctors told him, that they told him that he had severe arthritis in both hips, and he was eventually going to have a hip replacement, total hip replacement in both hips.
Wow.
Wow.
Yeah. And now, mind you, this gentleman is like 50, in his early 50s.
Yes.
So he was devastated by that. And he said as time went on, he had his good days, he had his bad days, and it seems that the bad days became more frequent. And then he started to talk about how this arthritis affected his livelihood.
Yes.
And not just affected his livelihood, but everything, his family and his acquaintances. There were times he couldn't get up and go out.
Yes.
The things that he would normally be able to do, he couldn't do. Simple things like getting up out of a chair. I saw this for
it's a lot of
myself.
pain.
I went through that.
You know.
Praise God.
So he was terrified. He didn't want to do that. So eventually, he ended up doing water therapy. He was trying to avoid it. He
Yes.
didn't want that surgery.
Yes.
And I
Yes.
know that.
What, like drinking water?
No, in the pool.
Oh,
the
the
swimming and
exercise.
Believe me,
physical
it helps.
aquatic
It helps.
therapy.
I did the same thing. I went to 24-hour fitness, and I got into the water, and you can move around freely and all of that with no pain. So go ahead.
Right. So he said that seemed to help. It actually helped a little bit, but the pain was still there. And he had very bad hips, and there wasn't anything. But of course, he was going to try something else.
Go ahead.
And so the next thing he did, he ended up getting a shot.
Cortisone.
So-
Cortisone shot.
So
yes.
they ended up giving him the shot, and he was so happy
Yes.
because all of a sudden he didn't have the pain.
Absolutely.
And that reminded him what it was like. And he has been suffering for a long time.
He's
go
young,
ahead.
in his 50s.
And-
That's not very old.
And it was, he was really
Okay.
suffering, because I saw it
Okay.
for myself. And so he ended up realizing, wait a minute, this feels so good. But needless to say, that wore off pretty
Yes.
quickly,
Quickly.
you know,
Yes.
after a while.
About-
and once again, he was back in the pain.
6 weeks, I think it lasts about
So
6 weeks, a month to 6 weeks.
Yeah, and he said the pain seemed to be worse because at that time he was doing things that he normally wouldn't do, so I'm sure he's making it worse.
It was still grinding, while
Yeah.
but it was like a blanket over it.
And then finally he just came to the reality that no matter what, he was going to get that surgery.
Yes.
The doctors came to him and said he was going to have that surgery. So in August 2012, he saw a surgeon, and they asked him if he was ready for the surgery. He said, I am so
Right.
ready for the
Right,
surgery.
right.
He ended up having the surgery, and he said it was the very next day after his surgery. I did go and see him in the hospital.
Cut it short.
So I'm in the hospital. He had the surgery, and then 3 days later, he was out of the hospital,
Yes.
walking around, and
Yes.
he would tell anybody,
Yes.
have the surgery.
Amen.
If
amen,
you're physically
amen,
able.
Amen. I went on July the 16th. And the 4th day, I was up with a walker. You have to go through the process.
Right.
You have to have a walker first.
Physical therapy.
Yeah.
Physical walker, and then physical therapy came to my home. I told them I didn't have a high bed. They sent my bed. They sent a hospital bed home to me. I think you saw it because he's my insurance guy. They sent a hospital because see they want to they kick you out the hospital. They don't want you to
Oh,
stay
yeah,
in the
too long.
hospital no more than 3 or
3
4
days.
days. So anyway, so they sent me the hospital bed with the pull-ups and everything. It was wonderful. I didn't want to give it back. I didn't want to give it back. It was high. And I could just push
Oh,
the
yeah.
thing. It would go up and down. I could watch TV. But it really takes a good 3 months to get yourself 100% back to normal. And I am so happy that I'm back to normal. But now, if you need dental work, before you have surgery, that's very important as well. You know why? Because if you don't, germs in your mouth could enter the bloodstream and infect the new joint. So these are the
Yeah,
things.
be careful.
If you're
Very careful.
if you're diabetic, you have to watch your diet and all of that. The doctor, you really have to check with the doctor. And if you are overweight, they say you're obese if you're over 10, 15 pounds. So some people cannot go for surgery unless they lose 30 to 40 pounds, and they have to keep walking around there in pain. However, right now I am an advocate. When I see someone, I said, did you go? I'm just bold. I
Right.
said, you go for surgery or what's going on? No, I've been walking around like this. I've met one lady in Glendora for 20 years. I'm afraid to go. I don't want to go. So that's what's out there,
People
Jennifer.
are afraid. They don't understand. They think that it's and it is. Surgery is surgery because any surgery is a serious deal.
Yes.
But to relieve that pain, to get rid of it, and there's no need to suffer and live like that anymore. Now, Mr.
Technology.
Adams. Exactly.
Oh, yes.
Mr. Adams is going to have his other hip done.
But it's
pretty
bad
soon.
to have two of them at one time.
He's going to have it done later.
Good, because
Yeah.
they
Second
they
one,
used
yeah.
to do two at one time, especially the
no.
knees. But it's too much.
Yeah.
Yes, too
That's
much.
what they
It's a
found
very
out. It's too
serious
much.
surgery.
But I got to let you know this before you continue on to in 19. This is still fairly new, you know.
Oh, yeah.
September the 28th, 1940, Columbus Hospital in Columbus, South Carolina, Dr. Austin T. Moore, an American surgeon, reported and performed the first metallic hip replacement surgery. 1940. That's not too far.
Yeah.
So anyway, but it was metallic then. Now they're putting ceramic and a little plastic along with the metal, which is good because metal on metal is no good.
No.
Right.
And now, when I went somewhere, I had to go to court or something with with my son. I went through the
line.
the little thing that beep, and I had my card. And I said, I have no what do you call it? I'm the bionic woman. I have a prosthetic in my.
Exactly. So they did the thing on you.
Oh yeah, and I said,
Right.
wow. But anyway, go for hip surgery or knee replacement. But they have other things that's out there now. Call it oh gosh, they are doing a study on. So you won't have to be cut. They're doing studies on that. I was trying to wait
So it's not
for that.
invasive,
Right.
non-invasive surgery.
Right. They have something that they stem cell.
Whoa.
Stem cell over at I
right.
know it because over at UCLA they're doing a stem cell research now with rats and all of that. I was trying because I knew the doctor that used to do it. He stopped doing it because now he's working over there at UCLA and they're trying to come up with a stem cell research which they take your own blood and some of your tissue and replace the cartilage. Isn't that remarkable?
Yeah.
See, and I thought about that. I was trying to wait for all of that to happen, Jennifer.
Yeah.
I was trying.
Well, maybe if your other hip gets bad, they'll
Oh,
have it.
that's what I'm talking about.
Because just,
Modern medicine.
Modern
gets better
medicine.
and better.
yeah, just here recently, somebody was given an award. I don't want to say be incorrect.
Right.
As far as if it was Japan or China, I'm not exactly sure, one of those places, but this doctor ended up getting an award for stem cell research. I think it was.
Keep on doing it,
Yeah,
doctors. Keep on doing those stem cell researches. Because, in this day and age, they can send a man to the moon and all of this stuff. Come on.
Yeah.
But now, since I used to walk with maybe I have to show you this. My first cane, my sister, I could cry. My sister, Gloria Hendry, who's an actress, she bought me my first cane. I said, okay, I'm going to live with this. I'm going to
It's a
buy
nice
all
one.
kinds of canes to go with my outfit. I'm going to live with this thing. So she bought me my first leopard
it's got
cane.
style.
Oh,
Yeah,
it had
that's
style.
gorgeous.
And then my doctor, what they gave me, they give you
yeah.
these. Now, these are beautiful and they do the job, but I didn't want to walk around looking like a quote old lady. So anyway, and then when you go to surgery and come out, so you don't, then you can take this and pick up a piece of paper so you don't have to bend down. I mean, all the devices that they have, Wendell.
everything. They got
And then what
everything.
else? And then they had a gold one. I said, okay, I'll wear that with my gold dress. Anyway, and then this one, beautiful.
Yeah, there you go.
Okay, beautiful. But
Sporty.
yes. And I said, and I had planned, Wendell, I was gonna live with this thing. Nobody was gonna cut me. But one time I asked my doctor. I've seen him about 4 times. I said, doctor, when do you think I would be ready? He said, And finally, I said, Lord, I can't take this anymore. It's not a snap, but I can't take this no more. I can't. I'm in too much pain. I don't want to continue to take these pain medications. And so I called him up, and he says, I got an opening in July 16th. He was going on vacation in August. So I said, I'll take it. I let go and let God. God said, it's time, honey. It's
Yes.
time.
yeah.
And he held my hand during the whole time. And I am so glad
Yeah.
that I went. I don't have any pain, no discomfort, Wendell and Jennifer.
There's,
Oh, yeah.
there's no need
So
for it.
if anybody, go online. They will show you, if you're interested in the stem cell research or what have you, go online. They have everything online to tell you what to do.
And I think
What do you
you're
think?
talking so much about, I mean, there's life, but then there's quality of life.
Yeah.
And so, I mean, the thing is, if you live in pain, there's really no quality of life. And so
Right.
it kills your creativity,
Yes, it
your
does.
activity, and depending on what your occupation is, it can be very devastating.
Hold that thought.
to
Can you
your
show
occupation.
the prosthetic thing that that they put in your hip that I have in mind? That's what they have there. And it's a wonderful thing. When I saw it in the beginning, I said, no, you're not going to put that in me. But that's a stem and a ball in the socket, and it replaces the damaged cartilage and all that you have in there. And you don't feel it. I don't feel it at all. You just can't. The doctor says, okay, 3 things. I said, can I do roller skating? Oh, no. Don't do anything that's going to make you fall. Don't
Right.
be in harm's way.
That's right.
You know,
Be
so
careful.
don't no roller skating. Do not run any marathons. I said okay. I was doing maybe 3 miles, you know, but anyway, you have to carefully. You have to do maybe Pilates,
Right.
careful. What do you call it? Exercise now,
Yeah.
since whenever you go for hip surgery, because you want this thing to last 10, 15, 20 years.
That's
I'm
true.
playing. I don't want to go through another one.
Malika, is it a muscle building type of exercise that you should be doing
Yes,
to support?
I'm glad you said that.
Yeah, because
Right.
that,
That's true.
That also helps to keep that muscle firm around it, and it
Stay
helps,
active.
doesn't it?
So
Yeah.
Stay
Stay
active.
active.
Oh yes, stay active. No pain medication at all. About a month ago, I stopped that. Yes, isn't that something?
Yeah, it is. Because I remember when Bo Jackson, he got his leg put right on television playing football with the Raiders. Then he went over and started playing professional baseball
Right.
with the new hip. So he was still able to function.
Yes,
and
but you
able
see,
to run.
yeah,
You have
but
to be
in the
very
long
careful.
run, he's going to eventually, if he wants to do that 5 years, 10 years, it's going to wear out.
Oh yeah.
And you know, you
Yeah.
can go back in. You can go back in.
I do everything.
I would,
go
you know
back.
what? I would go back in if I had to. But I have to say, the second day I gave my own blood. You know, if you know you're going to go for surgery,
That's better.
you put your own blood. I put a pint of blood. And so anyway, the second day they tried to get me out the bed, and then we needed clothes. They tried to get me out the bed, and then I almost passed out. My blood level, my hemoglobin was so low because I lost so much blood. So eventually they gave me 2 pints, and I prayed on that blood. I said, oh, I hope that blood is okay. You know, I'm O positive. So anyway, they gave me the other unit of blood, and I felt so much better. And then after that, physical therapy came in the second day, and I was just good to go. And I just kept on and on and on. And I was, see, the thing about it, Wendell, I was in shape before I went in. They just said lose maybe about 10, 12 pounds. So you'll have a better recovery.
outcome, yeah.
And eat this and eat that and do. Listen to the doctor. That's why they're doctors.
That's right.
They
No
know-
smoking, no drinking.
smoking, no drinking. They know about all this stuff. But people, we're stubborn. People are stubborn.
Yeah.
They don't want to listen to the doctor. What is it, Wendell?
I don't know. They want to
Jennifer?
go
Well-
left instead of going right.
Well, me being a healthcare provider or a healthcare giver, I find that a lot of people, it's fear, and people are
Go
set
ahead.
in their ways. And after working with different people from all walks of life, people are set in their ways. And sometimes it's just hard for them to make changes.
It is.
But
It
I
is.
tell you,
It is. It really is.
After suffering sometimes and going through pain and illness, it'll change your mind. You'd be willing to make some changes.
Yeah, and then there's some people, because I sell
Sometimes.
insurance, they'll go out on disability or kind of and still not get the surgery.
Yeah.
And go back to work, then have to go back out instead of taking care of the problem, because you don't want to be permanently disabled if you don't have
Right.
to be.
If you don't have to be. But and I just think the more things change, the better the technology, the more medicine changes for the best. I think people are going to be willing to give in to it, because and then after they see things like you jumping up and getting up as quickly as you did, and
Yeah,
Mr.
yeah.
Adams in the situation he was in, Charles Adams.
Yeah.
That's a miracle in itself.
Well, in Philippians 4:13, it says, "You can do all things through Christ who strengthens you."
That's right.
And can you give us a favorite scripture that you might want to share, and you too, Jennifer?
Okay.
Anything you would like to
I-
share
I-
with the viewing listeners? Tell them to hang in there.
You know what? That same thing. You can do
All
all things
things.
through
All
Christ.
things.
That strengthens you, because that is so true in every phase of your life.
Every phase.
Every phase.
Every phase, and always, yea, though you may walk through the shadow of death, I will fear no evil.
That's right.
Amen.
That's
That's
always
right.
my deal.
Oh, that's
Yeah.
wonderful.
Yeah.
And I'd like to say, keep smiling, keep believing, and keep it real. Keep it real. So any last words you'd like to talk about on this hip replacement or whatever? Because we're going to go into another show after this. We still have some great information.
I just think there's a lot of people out there that need to do it.
Yeah,
I
go
just,
ahead,
I
yeah.
just think that people need to listen to the doctor. I don't suggest doing it if you're not a real candidate.
That's true.
But it's not a chronic illness. Of course, there's a lot of things out there that you can do nutritionally or exercise-wise. But if you're living with the chronic illness, it makes absolutely no sense.
And I would also say, check out the different technology. Find out what might be best for you. Find out how severe it is. And once again, there is no need to live with that type of pain
No.
and to
No,
live
it's
like
not.
that.
No, it's not.
Quality of life is most important.
Yeah, but still, people they just can't. They'll have to, like when snapped, they'll have to snap into it and say, okay, I got to go now. Or they'll hear some kind of spiritual leader or someone tell them something, and then maybe they'll say, okay, that's my message.
That's it.
Because I let go and I let God. I didn't want to do this. Do you think not Malika from Malika's Christian World of Beauty, Health, and Fitness and World of Ministry. Here I am telling everybody to take care of themselves, and people see me hopping around. Woo! So I say go for it. Trust in the Lord. You'll have a better quality of life. Thank God. Thank God. Thank God for technology. Thank God for all the doctors, especially Doctor here at Kaiser Hospital in Baldwin Park. The whole team took care of me so well. And I have yet to go back there. I've sent them an email saying, oh God, it was just wonderful. World of Wisdom, Beauty, Health, and Fitness. Thank you again for listening to us and joining us. And we hope that you were educated today. And thank you both.
Thank you.
Thank you, Wendell and Jennifer. Thank you.
Thank you.
They're going to go separate. Come on. They're going to go Action. Oh, wow. Wow. World of Wisdom, Beauty, Health, and Fitness Ministry. This is Dr. Malika Hendry. How are you? And I hope, and I'm so happy that you're joining us again today. We have a wonderful topic to share with you today. And we have Wendell Morris.
Yes.
And then Jennifer. Now, but he is our special guest. We're going to ask him all kinds of questions, aren't we,
ready.
You
Jennifer?
most certainly are.
All
Are
righty.
you ready?
Now,
Ready.
who are you, for one?
Well, I'm Wendell Morris, and I've been helping people protect their income in the insurance world since 1985. So I think there's only three things that could possibly happen to someone. They could die too soon, they could get sick, or they can live a long time. So all three of those things you want to protect. There's nothing else left. You're either going,
right.
if you die early, that's not good. That needs to protect if you leave somebody. If you get sick and can't work, you know, that's a big problem.
Yeah.
And living a long time in this country and running out of money, that's a problem too.
Oh, yeah.
So you need to protect all three of
Yes,
those.
and running
So
out of money as you live longer.
that can be a problem. So those are the three areas that we'll talk about.
Okay. Well, can you tell us how is it that you can start saving money and preparing yourself?
Well, basically what people don't understand, most people will buy, say, for example, life insurance, but they won't buy anything, no critical insurance, and they won't save money. They'll buy just a term policy.
Right.
And they're betting everything. And what you're doing is you're betting everything that you're going to die early, which actuarially makes no sense because 95% of the people live past 65.
Yeah.
And most people, their term insurance, they'll get it. Can you imagine a 20-year-old getting a 20-year term? What is the odds of that helping them? The insurance company got help,
Right.
the agent got help, but the client really didn't get anything because 99% of the time, a 20-year-old will live past 40.
Right.
Come on, you're betting you're going to die before 40? It makes absolutely no sense to just do that. I'm 54 right now, and I don't look dead, do I? I mean, I think I'm going to live a few more years. And so you don't want to just get a term policy, only invest if you die early because of the odds. I think of it like Vegas. I mean, what are the odds of me living? They have stats on that. And then the chances of you getting a critical illness, it's about a 30% chance. That's why companies like Aflac and a lot of these, they've done studies that most people, about 30, 40 people, can get a critical illness, you know, in their lifetime. So
Like
that's
breast,
a higher.
like breast cancer? Is that
Critical
in it?
illness is like cancer, heart attacks, stroke, seizures, blindness, Lou Gehrig's disease, anything, car accident, things that take you out for a year, 2 years, and the doc says you're going to be all right, but you just, it's like a car going into the shop. You have to go
Right.
into the shop, get repaired,
Okay.
and come back. It's not terminal. Terminal means that the doc says you have 2 years to live. Or, you know, less than 2. That's a terminal illness. I'm not talking about terminal illness. I'm talking about critical illness. Most of us between now and 100 will have a critical illness.
Okay.
There's about a 30, 40% chance of that happening. So you need to protect against that. That's one of my biggest fears, not dying early. It's getting that critical illness and not being able to support my family.
Yes.
Right.
Oh, that's
Yeah.
an awful thing.
Yeah.
It must
As an
be.
offer to give you an
Yeah.
example, I had one of my clients, she woke up, she knew things wasn't right, ended up going to the doctor, went to 4 or 5 doctors, found out she had cancer. Cancer, went to the City of Hope. Cancer normally is a 2 to 3 year battle. That's a critical. The doc said, gonna make it. But after that 2 to 3 years, lost the home,
Right.
lost your credit. You know, it's very devastating. Had to have family and friends bring groceries. It's a serious thing because you could run out of money. Most people, how many people can last a year, 2 years without income? That's a very, very bad problem.
Yeah.
And so critical illness is not a good thing. I was talking to one of my friends, Pierre, he was on the phone, literally had a stroke while I was on the phone with him. I remember it like as yesterday, his wife was screaming, Pierre, Pierre, and he was drooling. And what it was, Malika, he had